Okay, final head to toe assessment. Let's start. Wash my hands. Okay, then we're gonna be doing the same thing. Okay. Head, ears, eyes. I'm gonna look into your ears and then your eyes. Look into your throat. You feel your neck. Listen to your heart and your lungs from the front and the back. Listen to your stomach. Palpate your stomach. And do some neuro tests. Okay. All right. First things first. Let's start here. Just relax. Tell me when there's any pain. Cephalic. Sinuses. Any pain there? Nose midline. TMs. Okay. Open your mouth. Bite down. Good. Very good. No pain?
No.
From there, I'm going to go to the pre-auricular lymph nodes. Post-auricular, right behind your ears. No swelling. Then we go to your tonsillar. Lymph nodes. Submandibular. Submental. Good. And swallowing. Anterior cervical lymph nodes. Pain there?
No.
No. Go to the posterior cervical. It's right behind the sternocleidomastoid muscle. Any pain? No. Okay, good. While we're there, I'm going to look at your thyroid. Swallow. Okay, good. Thyroid is midline. There's no nodules palpated. Look at your ears, okay? Is there any pain when I pull on here?
No.
No? How about when I touch right there on the tragus?
No.
No? Look inside your ear. Canals are clear, TMs are pearly gray, cone of light is present. Other side. Any pain where I touch here?
No.
No? How about when I pull here?
No.
Okay. Look inside the ear. Okay. Canal is clear, TM is pearly gray, cone of light is present. Okay. I'm going to test cranial nerve number 2, your optic nerve. Just look straight. I'm looking at your pupil constriction. Pupils are equal, reacting to light accommodation. Look up a little bit and look inside your nose. Okay, no secretions. Pink and moist. Open your mouth. Stick your tongue out. Say ah. Ah. Okay. Oral mucosa is pink and moist. Uvula is midline, 2+. There's no redness noted, no erythema. And that is good. Okay. Now, while I'm at it, cranial nerve number 2 is good. Now we're going to be testing cranial nerves number 3, 4, and 6. Let's see if they're intact. And usually by this time for vision testing, we use the Rosenbaum for close-up vision testing, and for long distance testing, or we use the Snellen chart. For pediatrics, to rule out strabismus, 6 weeks, up about to 6 weeks, we use the cover and uncovered test. Usually, one eye is covered with a card for about 1 to 2 seconds, paying attention to the opposite eye to see if there's any deviation to the side or if the eye remains fixed. Now let's see. Pupil constriction is good. I'm trying to turn it on, it's not working. But while I'm doing this, go ahead and can you see it?
Mm-hmm.
How many fingers am I holding?
One. Other hand.
Other hand. Which one's moving?
My left.
Just your left. Just look straight ahead. Don't look at the left. Look straight ahead.
Both.
How about now?
Both.
Okay, good. So look at this one right here. Follow with just your eyes. Okay, so crenulars 3, 4, and 6 are intact. I'm going to look into the back of your eye, okay? Just to see. Okay, just look straight ahead, all right? Red eye reflex. Get a little closer, okay? Okay, blood vessels are good and healthy. There's no signs of hemorrhage. Other side. Blood vessels are healthy, no signs of hemorrhage. Usually if there's signs of hemorrhage, where they're a little dilated, it could indicate hypertension. Red eye reflex bilaterally is symmetric in color and intensity. Okay, cranial nerve number 5, I am going to be testing. Close your eyes, okay? You're going to feel, you can touch 3 different places on your face. One will be soft, one will be a little bit sharp. So you say which side I'm touching and if it's sharp or dull, okay?
My left cheek feels soft.
Okay.
My forehead feels soft.
Okay.
Right cheek feels sharper.
Okay, good. Okay. So now we're going to test your ear again. Let me try something real quick, okay? Close your eyes. I'm going to be behind you. I'm going to whisper a couple of words or numbers. You repeat them back to me, okay? 9, 6, 8.
9, 6, 8.
10, 4, 3.
10, 4, 3.
Okay, good. So now this is called the Weber's test. It's for bone conduction. I'm going to make this vibrate and put it on top of your head. You tell me when you hear it, if it's stronger in the left or the right, and when it disappears. Okay?
I can hear it. Mostly hear it on the left ear. I think it's gone.
Okay. One more time. It's going to be here on the right side, behind your ear. Okay?
I can hear it.
Tell me when it's going. This is the Renee test.
It's gone.
Okay. Good.
Can you hear it?
Tell me when it's gone.
Gone.
Okay. Acoustic nerve, cranial nerve number 8 is intact. Okay, so let me see here. We are going to be doing cranial nerve number 9, the vagus nerve again. One more time. Open your mouth, say ah. Tongue out. Ah. Okay, smile. Puff your cheeks in. Puff your cheeks. Put your tongue to the left side of your cheek. Right. Okay. Good. So that is your part of your accessory test, your cranial nerve number 11. But now you're going to face left and right. Just with your face. There you go. Chin to chest. Look up. Look up. There you go. Shrug your shoulders. There you go. One more time. But now you're going to go push against my hand. Okay. To your left. Okay. To your right. Okay. Down. Okay. Up. Shrug your shoulders. Okay. Good. One more time. Swallow. Okay. So cranial nerves 2 through 12 are all intact. Okay. So now that that's over here on this side, I'm going to go ahead and look at your in there. Turn that off. Okay. Look at your carotid piece. Good. Listen for a breathing. So while I'm at it, I'm going to listen to your lungs and your heart for a moment. Go to the back. Okay, I'm up right side of the heart, right? Below the right atrium. Second intercostal space at the base of the heart, almost. Right above the pulmonary aortic valves. S1, S2 is present. There's no S3, no S4. No splits. A little bit down. S1, S2, no S3, no S4. Right above where the tricuspid mitral valves would be. Okay. Mid-clavicular level, around 5th point of maximum impulse. And there it is. Listen to your lungs now. Couple of breaths, okay? Okay, good. One more time. Okay. One more time. One more time. There you go. Okay. Lung sounds are clear. I'm going to listen to your lungs from the back. While I'm here, I'm going to go ahead and look at the back of your neck and your back. Any pain?
No.
Go ahead and put your hand towards your knees just a little bit, bend over like that. And lift your shirt here, helping your spine. Any pain?
No.
Okay, good. Spine is midline. No bulging discs, no signs of scoliosis, no lesions. Okay. So listen again. A couple of breaths in. Good. One time. Alright, that's good. Now, I'm going to palpate your back. Good. Good. Take a deep breath in. Hold it. Okay. Let me get that roll while I have it marked. Good. Okay, diaphragmatic excursion. It's about between 7 and 8 centimeters. Okay, go ahead and lay down. Lay back. Come up. Next, close your belly. Okay. Any stomach pain lately? No. Stomach is nice and round. No surgical scars. No lesions. I don't see any aortic pulse. Listen to the renal. Okay, right upper quadrant. It sounds present. Left upper. Left lower quadrant. Right lower quadrant. Bowel sounds are present throughout all 4 quadrants. Now I'm going to palpate. It's not too deep. Tell me when it hurts, okay? A little bit deeper now, okay? Does that hurt?
No.
No? Any pain there?
No.
Okay, now mass is palpable. Picture over. Any pain there? Breathe in. Breathe out. Okay.
No.
Okay, it's a negative growth sign. Any pain there?
No.
How about down and let go? Okay, negative at Bernie's point. Other side. No pain. Okay, negative Ralph's sign. Okay. Listen to your lymph nodes here. No swelling. Okay. So we're going to lift up. Any pain? No? Okay, I'm on now.
No.
No? Maybe it's soreness. Pain?
No.
Nothing in your stomach?
No.
No? Okay, so is this is negative. Now I want you to raise this up. Straight. Any pain?
No.
How about your lower back?
No.
No? Same thing with the other side? Okay, no pain? None in the lower back, huh? Alright. So now we're going to flex this. I'm going to put your heel to your shin and you're going to rub it up like that for a couple times, okay? Okay, good. Other side? Okay, good. Good coordination. That's a good cerebellar test. Fluid pulses here. Pedal pulses are present. Gluteal pulses are present. Okay, sit up. So I'm going to go down your clavicle to your acromion, shoulder. No pain there. Any clicks? Any pain when I do that? Okay, good. Other side. Good, no clicks, no pain. Okay, so one more thing with this right here. What I want you to do is put your index finger here on your nose, and then you're gonna go nose to my finger, nose to my finger, okay? So, okay. One more time. Okay, so that's good. Now, palms up like this. Palms up in the air. Arms in the air. Okay, one up onto your back, one to the lower back. Okay, nice. There you go. This side. Okay. Good. In front of you. Like this. Palms up. Do some movements. Okay, that's good. What's this? Brachial pulses. And do this side here. Just relax that. Relax it. Okay. Okay. Just relax that brachial. Okay, good. We'll move back a little bit, let your legs dangle. Okay, good. Okay, do TRs plus 2 there. Relax here. Okay. Okay. All right, stand up. Okay, arms front like this, just like this is fine. Up, palms up, close your eyes. Okay, good balance, negative Romberg's test. Put your arms down, open your eyes. Now you're gonna walk towards the door, regular way walk. Okay, stop. Now walk towards me with heel to toe. You're gonna touch your heel to your toe with each step. Very good. Okay, now you're gonna walk towards the door on your heels. Good. Come back on your tiptoes. Okay, very good. All right, so that concludes the Hi Nisha, so final head to toe assessment. There's a couple things that I did notice that I did forget as far as going from head to toe. I tried to maximize the economy of motion that I had going from head to toe, but there are things that I did leave out for starters that I want you to know that I'm aware of after the fact. Number one is that the abdominal assessment, after my palpation, I did not percuss, and I did forget that part. However, for the future, I know that I will be doing a thorough abdominal assessment, starting with inspection, auscultation, palpation, and percussion. Second is I
believe I forgot to verbalize Ortolani's and Barlow's sign. I think I got my head more wrapped up in the cranial nerves and trying to remember each and every one of them. Although not perfect, Ortolani's and Barlow's sign, these are things that have been used to screen newborns and infants for hip dysplasia. So usually they're used in tandem, as far as I remember. Ortolani's is used afterwards. It starts with the Barlow's maneuver, which usually the infant is laying flat. We flex at the hips and we push down, and it should dislocate the femur from the acetabulum. And right after that, usually we follow with Ortolani's maneuver to verify that we were able to dislocate it. So what it is we adduct this time using Ortolani's maneuver. We adduct the hip and then we pull a little bit downward. So if that hip indeed pops back in, we should hear or feel a click, which would make it, I think the diagnosis would be positive for hip dysplasia or posterior hip dysplasia for the children. As far as eye exams go, Rosenbaum is for the using that Rosenbaum chart. I don't have any with me here at home, so usually it's testing near vision, and it's vision that's going to be the chart's about 14 inches away from the person. For distance vision, we use the regular Snellen chart, hanging around 20 feet from where your patient's going to be. Standard eye exam, pretty much. And for pediatrics, for children, it's hard to gauge what their eyesight's going to be. So usually, especially for the little ones, the toddlers, we use the cover and uncover test, which is usually just a little card or something to block one eye and then the other. Usually one eye is blocked at a time, about 1 to 2 seconds, and you pay attention to the other eye if there's any fixation or deviation to the right. This is so that we can determine if there's any strabismus and if that child would need a follow-up referral to an ophthalmologist or optometrist for specialty care. And as far as I know, that's what I have forgotten on this head-to-toe assessment. I kind of tried to do the head-to-toe assessment while I was at work the other day. I brought everything, but it just wasn't working out because we had constant interruptions, and then by the second go-around, we got really busy. So I scratched that, and I figured, you know what, I'll just do it here at home and work with what I have. So hopefully this will work. Let me know, Nisha, if you need me to add anything or redo anything. Thank you.